Hi, welcome to You Can Do Medicine. My name's Tom and I'm a second year medical student here at Edinburgh University. It's good to see you. And just thought I'd do a video, just sort of giving an update as to what's been happening in second year. It's now week 4 of semester 1. And what's been working for me really, and how I'm finding this in comparison to last year. And so just starting on it, what's been happening, and so we've got the body in motion stuff, focusing on neurology, looking at lots of different aspects of neurology. Like I've been doing notes today on delirium, functional neuroanatomy of balance, cerebral syndromes, and I've got some coma stuff to do after this. But yeah, that side of it has been really good. I have been down at the Royal Infirmary quite a lot, which is quite a pain to get to for lectures, but it's because the Appleton Tower still has problems going on. The other subjects, PBL continues to be PBL. SEAM, we've only had one SEAM class. Seems a bit odd. I can't even remember what it was on. That's not a good sign. It's just SEAM. I don't know what more to put in there. REBM still continues to baffle me. We're still continuing with coding, and yeah, I think it's just an academic exercise. It's got nothing to do with medicine. I don't know why we're doing it, but it's a box that needs ticked. And but the more interesting aspect of it, the KCP, going out to GP surgeries, although we haven't actually seen any patients yet, and we won't until next week, it's still good to be actually out in a GP surgery speaking to someone who's on, the coalface sort of thing, and seeing practical skills, and I think that that's going to be really good actually working with them next week. But I suppose that all round, how's the year going? I would say that it's essentially just been a continuation of last year. I would almost say that this semester is like semester 3 as opposed to, a following year, It's just a continuation on the courses running exactly the same format. It's at the same level. It's not any more difficult. And, what's been really good there is that I can just look back and see what's worked for me last year and put that into practice. I think as well, because I'm settled in Edinburgh now, I have a really good routine, and I can just fit everything in. I mentioned the notes that I did for body in motion earlier on today, and it's because on a Monday I've got the whole day off at the moment, so I'm basically getting up, going up Arthur's Seat, up to summit number 214, and came down, shower, breakfast, and did notes on 3 lectures there, and then I actually went up Arthur's Seat again for the 214. But came back, had some lunch. I know that I've got some more notes to be doing, but I'm just going to be, I was like, let's make a video. I haven't made one for a bit. And but throughout the week, I can just forward plan, I can see the gaps, I know how long things take, and I can just fit in what's worked last year into this year. And I would say that I've settled into it really quickly. I know that some people are still kind of struggling, that they're finding it, it's almost like starting again. I don't know. For me, it's just about keeping things simple and, seeing this as the most important thing in my life. So this needs to prioritise on top of everything. I'm still working at the Royal Infirmary, just doing Saturdays, although I did Friday night a while ago. Survived. But I did a Friday night after a full day of lectures on a Friday. It was pretty tiring. Anyway, but I know, I can plan out my week. I can fit in where everything needs to be done. I know that tomorrow I've got PBL at 11 o'clock, followed by REBM at 4. So in the morning, I'm just going to skim over whatever it is I need to be looked at PBL wise and review my stuff. We get the stuff for REBM a week before, so I'll be looking at week 3 stuff for tomorrow's class. But then the gap between PBL and REBM is 3.5 hours, so I'm just going to go to the common room and watch all of the pre-recorded lectures and just sort of, take that in. I normally watch them at like 1.5 speed, so you just, you can work your way through them fairly quickly, and I don't actually take any notes while I'm doing that. Then, I've got the evening free, so tomorrow night I can do whatever I want, and that's like parked free time. Come Wednesday, we're away down at the Royal Infirmary for 9 till 1, doing lectures again, and then after that, I will come back and I'll look through my notes. I'll see if I'm going to do them then. I might wait until next Monday like I did today. But these are all things that I can plan in and understand how to park my time, how to arrange my week. And I can just throw in exercise whenever I can in there, and I can throw in any socialising as it comes. And yeah, I think that just planning, sticking on top of, my well-being things are eating, sleeping, exercise. If I'm out of kilter, it's because one of those 3 isn't right. At the moment, all those things are well. I'm continuing to sort of gradually lose weight, do my batch cooking, getting a good diet in, and I'm sleeping well, so everything's going fine. And I would highly recommend that if anyone's struggling, that they should look to do the same. Anyway, as I said, just so we catch up, so I'll see you soon. Bye.